for the talk. Thank you to the previous speaker. Very impressive talk on how he saves lives here in Malaysia. And I am an emergency medicine specialist in Singapore. And I'm also involved in undergraduate medical education, postgraduate medical education in Singapore. And I also do policy work for Ministry of Health in crisis strategy and operations in Singapore. But today my talk is on healthcare education, and I use medical simulation in Singapore, and our simulation center is on two equipment, right? And what we use these for is to mimic real-life conditions, emotions, and situation skills, high fidelity simulators, and also we use actors. Okay, we train actors, not professional actors, because we cannot afford how to create a program where we train our students to experience things that may be difficult times. And that's how you get quality programs. And when we talk about simulation, the medical education outcomes, it's used as a form of ensuring standards in medical education. This is the Liaison Committee of Medical Education. It's quite long ago, 2013, and they set up guidelines for medical education in medical schools and medical colleges, and incorporating medical simulation into their lectures or into their training, because they say they are very happy with giving a lecture. All right, simulation to change learner behavior, because at the end of the day, we want your learners to change their attitudes so that they become better healthcare professionals. So I refer healthcare professionals, both undergraduate and postgraduate, right? So it's both a system, a group that defines what are the conditions that your learners must encounter. So the conditions that your students in India, there is limited curriculum time, scheduling is always a headache. Where do you place the students? They have lectures. Is to make sure that as educators, you correlate with established educational theory and pedagogy, right? Into established hierarchy of learning, right? And this is to make sure that you meet the learning objectives and you attain learners, and you can have simulation programs for the experts. We have simulation programs even for the very senior experts, all right? And testing on certain Bloom's taxonomy. Most of you may have heard of Bloom's, right? And this Bloom's taxonomy is a set of 3 models used to classify effective healthcare professionals. We have to ensure that your students have attained these attributes in the knowledge acquisition, to upwards, to comprehending what they have learned, applying, analyzing, and synthesizing, and finally evaluating cognitive domain. So going from the bottom on the right, this is the original domain, has been modified to a new domain on the right, bringing your learner up from breaking it into parts and understanding how each part is related to one another, and evaluating, making judgments, and finally creating what they have learned. But when you use simulation, we expect students to have the basic knowledge. Simulation is not a tool to teach them basic theory knowledge. Simulation is a tool to make them apply what they've learned, right? How do they apply their knowledge, analyze, evaluate, and create, right? Here. So again, bringing them up. This pyramid is a reverse pyramid, but the same thing, right? So how do you use this pedagogy simulation to enhance the cognitive domain? So you can see this is a group of our medical students. They are being assessed. We can also enhance the cognitive domain by using other forms of technology like computer-based simulation. We give them computer, okay, this way, from the receiving to the characterizing phase, right? So receiving phase is, of course, for a novice. In terms of receiving means, of course, just listening, noticing, and tolerating. Just listening. Has a stroke, angry patient who's been waiting for a long time for treatment, and there was delay in treatment, and getting angry. And how does a skilled anything, right? Skilled pilots also use simulation, right? Surgeons use simulation. Some may be basic, some may be complicated skills, lumbar puncture, It's just chest compression, CPR. It's just defibrillation using a defibrillator, right? Ultrasound, how do you put in a ultrasound guided central line? Surgeon teaching them how to put in a chest drain, and learners observing how to do that and then practicing on their own. How to do endotracheal intubation with the anesthetist as the educator there, right? And also there are different technologies out there. This is computer-based simulation using this skill level from the perception phase, just using sensory cues and sensory stimulation they need to do. So to put it simply, is in sports, estimating where the ball will land, where the ball will fall. I mean, I'm using sports as an analogy. Guided response, this is the early stage in learning a complex skills. And in this phase, of course, it includes imitation, right? And basically, if you, what's the analogy? Stage in learning a complex skills, where the response, when you sit in your car, you don't tell yourself, oh, okay, step 1, put key ignition. Step 2, turn it clockwise. Step 3, release. We don't tell ourselves that, right? It becomes much further when we want them to reach this phase where it is a complex, coordinated performance requiring a minimum of energy, right? So they become more proficient. And again, automatic performance, performing without hesitation, right? Word response phase where it becomes a bit more complex. And then the patient B or patient C, because the patients are different, right? So how putting a tube this way, when the patient stops breathing, how do you make a incision in the neck? Putting where, of course, you become an expert, and this emphasizes creativity based on highly developed skills, all right? So now, of course, these stages will take years and years of practice. We don't expect a student to learn all this and become competent, all right? It can be an objective test of learning. You can use simulation to test whether your learners have attained skills in the cognitive. You can also monitor them in the real clinical environment, get feedback, all right? Have they learned have they been using the skills, and have they become better healthcare professionals, right? So again, when you talk about clinical competence, to show you what they have learned, right? So simulation is not telling you what they know or telling you the behavior. I mean, that's what it's all about. And there's another theory. This is Kolb's experiential learning cycle, where we use simulation to give them maybe incorrectly, remove that, create a safe what is expected of them. Okay, so Lewin's unfreezing change model is another way of using simulation, all right? You unfreeze them, you make them learn new concepts, and then you refreeze what you have taught them. You make it more obvious. You sort of give a lot of distractions, all right? And sometimes we miss the signal, which is the truth. A lot of distractions, you know, we even have nurses only if it is effectively delivered and debriefed. All right? In debriefing, we use what is known as a good judgment model in practice, integrating curriculums for learners, and it's an effective learning tool. All right? So we don't have money, we don't have finances. Yes, it can be expensive.